Well, we're back, and I hope everybody had a good break and is ready for our final session. I'm excited to introduce Tina Marshallek, who is moderating our next and final session of our conference. She has worked with Covering Wisconsin for 2 years as a health coverage navigator, and this year became our interim community relations coordinator. In addition to assisting consumers, she also supports statewide outreach, manages our Community Mobilizer mini grant program, and completes many partner focused trainings. She has her Bachelor of Science from the University of Wisconsin-Madison in Community and Nonprofit Leadership, where she honed her craft in community-based decision-making and elevating lived experience. Hence why we are, and she is elevating this session today, which I'm really excited about. It's a session we've not yet ever been able to do with this conference. So thank you so much, Tina, for making it happen. And thank you, guests and guest presenters, for being here and taking the time to share your experiences. And so with that, I'm going to hand it to Tina.
Thank you so much. I'll just share my full screen. Welcome to our final conference session, Health Insurance in Real Life, a look at lived experience. I am so excited for our time here today. We do have a consumer panel here with us. I will disclose that I am getting over COVID, so I apologize if I need to take a moment to catch a breath, but I seem to be doing pretty well today.
And just sorry, Tina, and if you could just share your you're in the back end of the PowerPoint, so just go into presentation mode if that's possible.
I did go into presentation mode. That's not showing?
It's not.
Maybe I'll stop sharing and I'll reshare.
Okay. And if not, it still looks good, so we can.
Okay. How about now?
Same. It still looks the same to me.
It's not in presentation mode?
Not for me, but if you want to keep going, we'll just go.
Yeah, we may just have to keep going. Sorry, everyone. Thank you for your patience. It's a brief presentation before we get to the panel. I just wanted to address for everyone briefly why we're choosing to highlight lived experience today. First, we want to apply the sometimes dense health insurance rules and regulations into real life. Especially if you are in pre-licensing, you are likely observing that there are a lot of rules and policy to learn. And when you're doing enrollment assister work, that policy comes to life. And real life scenarios don't always fall into these neat policy buckets or as simple enrollments. And what better way to show that in our training than with real life scenarios? Working with people also involves topics and an interpersonal skill set that are not always represented in those policy-related trainings. We want to include training of the scenarios you'll likely encounter working with people, which is an additional skill set from understanding and working with health insurance. Some scenarios you might encounter include things like describing complex systems in a way that people can understand them, and considering what trust people may have in institutions when you're helping with an enrollment. We also want to include consumers in assister training, recognizing people with lived experience as both a key stakeholder group and as those most impacted by our work. Sometimes if we don't hear from a group's perspective directly, we can misunderstand or misinterpret that understanding of a situation or an issue. That's why stakeholder engagement and partnerships are so important, which you just heard about in detail in our last session. But sometimes what we miss in our work is that arguably our most important stakeholder group is our consumers. I also wanted to highlight the expression, nothing about us without us. It has roots in Latin, but in English, it is often applied in reference to the disability rights movement. The reason I'm choosing to highlight it today is because I think that it just has a powerful point around representation that failing to include those most impacted by our work can lead to our work being out of touch and not serving them fairly enough. So nothing about us without us, and we're including consumers today. I also wanted to go over what protections there are for our consumer panelists today. I understand thoroughly that all our work with health insurance often involves sensitive topics. And consequently, I did work with each panelist individually to ensure that they know that they may skip any question and or any topic. Their participation is fully voluntary today. All panelists have also completed a media consent form, which indicated that any conversations they had with a navigator are still subject to the same confidentiality and privacy requirements outlined in that navigator consent form. Any information shared about their experiences will be from them, and they decide what to share. When I introduce them, I'll even just say name and where they're from, and I'll let them tell their story. They are all comfortable being recorded and for this session to be posted online, and they're aware of that. They're also being compensated for their participation, and they can revoke their consent at any time. All of these consumers have worked with a navigator, so that is an added qualifier to their understanding of our work. 4 of these panelists have worked with me, and 2 of them have worked with other navigators. Other Wisconsin navigators were encouraged to invite consumers to join this panel to encourage regional diversity. However, since most panelists did work with me, and since I reside in Madison, Dane County and Madison is a bit overrepresented. We had 2 people who were outside Madison, Milwaukee, and unfortunately, one of them is unavailable today. So we do only have 1 person outside Madison, Milwaukee. I did try to improve our regional diversity, but I want to give that qualifier before we begin today. I also want to be sure to thank our panelists so much for your contributions today. I want to help you for your help in helping us understand what challenges people have and what we as navigators can do to better educate and guide people. And time for our first poll question. The saying, "nothing about us without us," is often attributed to what social movement? Women's suffrage, the Black Civil Rights Movement, the Disability Rights Movement, or the Temperance Movement? And I can even stop sharing my screen at this point, because after the poll question, we'll introduce our panelists.
Yeah, and that poll is running, and votes are coming in. So let's give people another 15 to 20 seconds, and then that can be shared on screen to see what people said.
Great. Looks like the majority of people got this correct. It is indeed the Disability Rights Movement. And I apologize if you couldn't see each of my slides as I was clicking on them. I'm not sure why I had technical challenges with that today, but I promise I was going through them. Now we get to introduce our panelists. I will introduce them one by one. And as I introduce them, I'd like for our panelists to take a moment to answer our first question, which is just, tell us your story around seeking health insurance. Why did you work with a navigator? Our first panelist is John Mano. John lives in Ashland, Wisconsin. Thanks, John.
I live in Ashland, Wisconsin. I'm a retired professional musician. And due to the slings and arrows of outrageous fortune, my income spiked in 2021. This meant that I wasn't able to comfortably afford the much higher premiums I'd have to pay in 2022 because my income on that year would have been significantly lower. So I decided to cancel my coverage, but as fate would have it, due to degenerative disc disease, my L4, L5 disc herniated, seriously impinging the nerve root and causing a significant neurological deficit in my right leg. I needed surgery, and it absolutely couldn't wait until 2023. When I was planning on reapplying in November of 2022, and my coverage would have kicked in 2023. This impingement happened in May 2022, and I needed health insurance now. So I had worked with Tina before, and in desperation, I called the poor woman to see if there was any possible way I could get health insurance. Thank heaven there was. Tina knew of a little known loophole that could be invoked in certain emergency situations. And in 1 hour, I had coverage. I was able to get the treatment I needed, which otherwise would have cost me well over $100,000. So I'm very thankful to Tina and this organization. So that's what I have to say.
Thank you so much, John. Our next panelist is Rachel Lichman, who lives in the Madison area. Rachel, did I pronounce your last name correctly?
Yes, you did. Can you hear me?
Yes, I did.
Perfect.
And
Awesome.
I can. Sorry. Thank you. Would you mind sharing with us what's your story around seeking health insurance? Why did you work with a navigator?
Yeah, so my name is Rachel. I use she, her pronouns. I'm from Madison, Wisconsin. I was looking to work with a navigator because I'd been on Medicaid for quite some time. I was a college student and I'd been experiencing homelessness and housing instability. So I was on Medicaid for a while, and then the pandemic happened and I hadn't done my renewal for quite some time. And I was worried that I might lose my Medicaid coverage and might need to go onto marketplace coverage. So I was working with a benefits counselor who suggested I reach out to Covering Wisconsin. And so I did. I called Covering Wisconsin, and they helped me go through my Badger Care renewal and explore other marketplace plans in the event that I might lose my Badger Care coverage.
Thank you, Rachel. It's helpful to hear. Next, we have Kenita Hickman from the Milwaukee area. Kenita, would you mind sharing with us why you worked with a navigator?
Sure. Can you hear me?
I can.
Cool. So I actually have 2 entry points into working with a navigator. The first one was around 2017. I had gotten a new job at a local nonprofit, and they did not offer health insurance. They offered a stipend. And so my healthcare navigator is actually a really good friend of mine. And so this would be the first job that I had that didn't offer insurance and instead offered a stipend. So I just had no idea how to even navigate that space to get insurance. I do have 3 autoimmune chronic illnesses. And so I definitely had some concern in terms of how to continue to care for myself if I had a relapse, but also, just as a woman and like women's health, like what would those options be? And so, because my friend worked as a navigator at that time, she was able to help me go through that process. And then I re-entered working with the navigator in 2021. I quit my full-time job and decided to become a full-time entrepreneur, and didn't know how to, again, just navigate this insurance space, and wound up working with a navigator to get insured.
Awesome. Thank you so much for sharing that. Beth Parisi is our next panelist. She lives in the Madison area. Hi, Beth. Oh, I don't think I can hear you. Are you maybe muted?
Can you hear me now?
Yes, I can.
Okay. So
Perfect.
I'm from Sun Prairie, Wisconsin, and my situation was 20 years working for the same employer, and they closed my division down. So health insurance to me was always through an employer, and I covered both my now young adult children. And I really didn't know what my new position, I did get a new job, but I didn't know what that would, what my insurance would look like. And so I knew that I wanted to reach out to someone to figure out next steps. And so I saw a television commercial for you folks, and that's how I reached out to Tina. And she truly helped me work through not only my insurance needs, but my children's needs as well.
Awesome. Thank you so much, Beth.
Sure.
And then last but not least, we have LaVonda Stewart Whitley from the Milwaukee area. Hi, LaVonda.
Hi, how are you?
I'm great. How are you?
I'm doing great. I'm really happy to be here today. I actually worked in Milwaukee Public School District for about 33 years. And in the beginning, starting, I really didn't use the insurance. We had some really good insurance, so I didn't really need to use it that often. But then as I got older and things changed, and after I retired, I found myself where I had to really get another insurance. And that's when I used my navigator, which was a family member. And I was just talking about, tried to, how confusing it was to actually get, choose an insurance, because I was so used to having the coverage I had before, and I knew it was taken care of. So it was so when I chose the insurance on my own, I found myself coming out of pocket for a lot of different things. And some things I just didn't do, as far as working on my health issues or going to the doctor, because I knew I was going to have to pay quite a bit of money, for the bill. So I was just talking one day, didn't know she was, my navigator was Cheryl Isabel at the time. And we were talking, and I said, oh my gosh, this insurance is really, I'm just having a lot of troubles with the insurance policy I have. And lo and behold, I didn't know that she was a navigator at that time. And so I decided, she helped me get my insurance. And then to top it off, she was actually a navigator for one of my friends too. And she was just talking about how, how much help it was. And it was just such a relief to have a navigator. It took away a lot of I now have coverage that actually fulfills the needs I have health-wise. And that is my story. And I appreciate having a navigator. We need more.
That's awesome. Thank you so much, LaVonda. Now, if we can get all the panelists on the stage with me. We're making great time. So I would like it if everybody could answer this question, unless, of course, you want to skip the question. You've all talked a bit about what some of the challenges were you encountered while you were trying to find health insurance, or when you were just going through the transition that led to needing health insurance. Can you talk a bit about what barriers or challenges you had in getting affordable health insurance? We could start with John, if you're able to speak to that.
The only barrier I would say that I have encountered in acquiring health insurance is the what do they call it? The open enrollment periods. They are limited and bizarre. It's like, why can't I just sign up for this whenever I want to? Why do I have to wait till November? That's the only barrier. That's the only barrier I have encountered, and for me, that's always been a rather significant one.
Thank you. Rachel, do you have any thoughts on this?
Yeah, so I think for me, especially being on the younger side, I think and as someone who doesn't have family members I can turn to and ask, like, hey, what does all of this mean? I just find health insurance very, very confusing. And so as someone who was also on Medicaid for a very long time, when I was looking at the marketplace plans, I was just very confused, and I didn't know what like deductible meant, what copays were. And so I had to do just like a lot of Googling and trying to figure that out. So it was really the first time that I was hearing those terms, since they're not usually terms that are used anywhere else except for insurance. So just trying to figure out what that meant was really confusing for me. And I think just understanding insurance and how it worked was a barrier for me. I do think I understand it more now that I've worked with a navigator, but that was definitely something that I was struggling with at first.
Good. I'm glad to hear that working with a navigator helped with that. A lot of our job is going over all of that health insurance terminology. I don't know that it's always something that we teach people in everyday life. So that can definitely be a barrier to accessing affordable health coverage. Kanita, did you have any thoughts on barriers or challenges to finding health insurance?
No, I mean, not for me personally. With my good friend being a navigator, she walked me from A to Z. I get the reminders once a year, via text or email saying that I need to sign up. I'll say I think a barrier at large, though, I work with the creative community here in Milwaukee. So independent creatives, musicians, artists. And I would say that at large, a barrier has been communicating this message to creatives, to making sure that they are insured. So through my company, I work with 13 contractors, videographers, graphic designers, stylists. And of the 13, 12 of them are based here in Milwaukee. And so I've had a meeting with them and connected them with my navigator to get them insured as well. A lot of them had either never worked with a navigator, so they were paying too much, or didn't even know that this was an option. And so because of that, now people on my team have dental care and they have a primary care physician. And this is for folks who hadn't been to doctors in years because they've been going the independent creative route. So I think that's a barrier. How do we communicate to local musicians and local artists at large that this service is available to them, and that even if you fall below a certain amount of income annually, there's state insurance that's available to you as well?
Yes, thank you so much. Those are great insights. Getting the information out there about what resources are available through healthcare.gov or the marketplace or Medicaid programs, if you're eligible for them, is so important for people who are self-employed or people who have an employer that doesn't offer health insurance. You mentioned the texts and the emails reminders are helpful for you. Do you think that there's any other messaging that is helpful for this audience in learning what's available to people? John has thoughts if you don't, or after you.
I think there should be just some type of campaign, you know what I mean? Working with the artist community that really speaks at large about what this is. And if that was something that you guys were interested in doing, I would love to help with that. That's something that I've been talking to my navigator about for years, my navigator / friend, that there has to be some type of campaign that really speaks to artists specifically. I think to Rachel's point, it's also really hard to talk about your medical history to a stranger, right? So also helping to like break down that barrier so that people feel comfortable talking to a navigator and talking about what they need to make sure they get exactly what it is they need so that they can be taken care of, because healthcare should be a right for everybody. Everybody should have access to healthcare. And because of the marketplace, now more people are able to access that. And that's a really good thing.
Awesome.
So I'd like to add into that. Yeah. So, you talked about, the artists and this population that's missing some of this information. Well, in my case, it was my children, my daughter being a college student, no idea where to turn, right? So she always relied on her mom to have her on her plan, my son as well. And my biggest barrier was that this new job that I got, my base salary excluded me from doing this program. So that was really frustrating to me, but Tina was so helpful in looking at the three of us and what I would be paying for my premium, which I feel is super high. I almost want to go part-time so I can be a part of this plan. I mean, it's crazy what I pay as an individual for healthcare. But very grateful that my children, my daughter being a college age student, working as a waitress now, is able to afford healthcare, and she's just ecstatic about it. I think another barrier though is estimating what they're going to make in a year when they are working kind of these part-time jobs, and they might have 2 or 3 jobs, or like my son, he quit his job. So now what happens to him? So if I didn't have a navigator to help me kind of go through all this, I don't know what we do, and as young adults, I know my son is not very trusting of the whole healthcare system. I'm not always very trusting of the whole healthcare system. So having a navigator helps kind of the communication of we can work through this is really helpful.
Awesome. Thank you so much for sharing all that. And I'll come back to Lavonda to ask about barriers and challenges, but I know John had raised his hand quickly with thoughts about messaging, and I just wanted to jump back to you real quick.
Sure. Speaking as somebody who was a freelance musician his whole life, Ms. Lavonda, I understand the people that you work with. I found that word of mouth is really powerful for independent people who are not part of institutions and things like that, who work the gig economy. It really helps to have someone say, hey, do you have health insurance? I do. This is how I found it. Talk to this person. For me, that was the most powerful way, the most powerful method of communication.
Yes. Word of mouth is very important, we have found as well. And Lavonda, did you have any thoughts about what barriers or challenges you may have in getting affordable health insurance?
And clarifying what you need, what's best for you. I really think that, because in my younger years, I knew I could, I really didn't have, like office visits for $15 or so. And now you have to determine that is this okay? In this plan, office visits are $50. Which one is best for you based on what you can afford? And it's a lot of things like the diagnostic test, when they ask you, do you want this blood work, or, different, can you test this? Sometimes that's an extra cost, but so you got to really know your insurance, and like, for instance, if you want to say, could you test to see if I have overactive thyroid gland or something? And those are, before I could say, oh yeah, sure, just test that. But now you really have to know what's covered. How much it costs. You may not have known exactly how much it costs before. So just knowing exactly what you need, and if it's age appropriate, like Rachel was talking about different things, like she didn't, when she was talking about what she needs, I think that's what we have to, like when you choose it's nice to have a navigator so you can ask these questions. And I had one example not too long ago. We had a health fair at our church, but one of my members, she was starting to having to pay $1,000 for her monthly medication. And she said, all I did was, I thought, I'm gonna change my primary care, my healthcare plan to this, to another one, not knowing that it increased her monthly prescription. So her monthly, she couldn't afford the amount of money it was costing her. Then it was $1,000. And now with the help of a navigator, she only has to pay $28. So you really have to know what's best for you. And even when you're choosing a different plan every year. So.
Thank you. Yes, understanding costs with your health insurance plan and how much you're going to have to pay out of pocket for different healthcare is so important when you're picking a plan and when you're grasping this idea. Excuse me. As a navigator, I'm trying to get better at helping people use their health insurance, not just obtaining it, but understanding what they will have to pay if they go to a doctor, for example. Not just Lavonda, but if anybody has any thoughts on this, I'd like to learn something you found challenging in using your health insurance and what you wish you would have known before you encountered the problem. For example, did you have any issues finding a doctor or getting an appointment or understanding the costs and bills? And what would have made that process easier? Anybody who has any thoughts is welcome to share.
I would say getting an appointment. My 88-year-old mother, who has insurance, called to get an eye appointment, and it was going to be a year and a half down the road. A year and a half.
My goodness.
So that, and even for myself, when I try to schedule things, it's 3 months down the road. And so the trick is to, well, you get on a cancel list, but they're not going to call. I mean, they say they will, right? But so I started calling every day, and he cancels, and he cancels, and he cancels. And then like, yeah, can you come this afternoon? So I think that's important for people to know too, is there's such a shortage and there's such a long wait time for procedures It's really frustrating.
Yeah. Okay. Wait times, wait lists, getting on those call me if you have a cancellation lists. Did anyone else have any thoughts on this? What could have been helpful with understanding how to use your health insurance, if anything?
I will say, I think with my health insurance, the thing that was really challenging is my HMO kind of tries to deliberately make information very hard to find. So I feel like I will go on their website and be like, is this provider in network? And I cannot ever find the correct information. It is just like unnecessarily complicated. Sometimes their portal like doesn't work. And so I'll like call my insurance and then sometimes they'll like say, no, it's not. But then I'll call the hospital and they'll say, yes, it is. So it's like I'm getting all this very conflicting information. And so I've learned just through experience that like oftentimes it's better for me to just call the hospital and see like or whatever healthcare provider is and see like if they're in network because when I call my insurance, they often give me very conflicting information and information that isn't always accurate, which is unfortunate. But I've learned like if I just call the healthcare providers, I have a lot better luck in determining whether or not something is in network or something will be covered because getting that information from my insurance has been very difficult.
Such a helpful tip if you are seeing conflicting information from your insurance company is to reach out to the provider. Does anyone else have any other thoughts on this? Otherwise, I can move to another question. All right. We talked about challenges and barriers for you. I wonder, when you think about your community and whatever that means for you or your friends and family members, and Beth talked a bit about that, do you think that there are any challenges unique to your community or your friends or family members that are important to consider when helping someone with health insurance? Anybody who has any thoughts, welcome to share. It's okay if not. Go ahead.
I can jump in again. So yeah, so there's a couple of different communities that I'm a part of. So I think first just starting with disabled people, disabled young people. I'm someone that has several disabilities, chronic illnesses. For people like me, I know at least for me personally, I can't work a full-time job. That means I will never be able to get health insurance through like traditional employment. So I think that is often a barrier is that my options for health insurance are either through the marketplace or through a state program like Medicaid or MAP. And so I think that is a barrier is that like I do have to deliberately seek out other programs rather than just being able to get it through my employment. And then I also think for youth who are experiencing homelessness, getting health insurance is a huge barrier. First, just because we don't usually have trusted adults that we can ask questions to. It's really hard to just get information because we are on our own. We don't really have a lot of trust in systems. And we also might find these systems very confusing if we're just learning to use them for the first time. And then the other part about that is like if you're not stably housed, getting eligible for Medicaid can be difficult just because you don't have an address or you might be moving across state lines. So there's just a lot of difficulty in being able to even get health insurance in the first place when you don't have stable housing. So, yeah.
Both homeless youth and people in general experiencing homelessness, it can be very difficult to reach these folks because sometimes the traditional outreach and promotional methods are not as successful, especially with mail if you don't have a reliable mailing address we found. I'm curious, Rachel, do you have any thoughts on what messaging or outreach might be most helpful for reaching homeless youth? It's okay if not.
Yeah, so I do think like I think the big thing comes down to trust. And there has to be people that young people trust. I think a lot of times that especially myself, I often didn't reach out to systems because I'd learned not to trust them over, reaching out for help several times and never really being able to get the help I needed. So I think it's really important that there are like youth specific services and services that are geared toward that population. I think that's really helpful for trust. Also, just like I think a lot of people are on the internet these days and online, and so that's often just a much more helpful way or available way to get in contact with people is um, through the internet and online, just because it's a lot easier to contact people that way than through mail. And I know a lot of the information I found, even though it's been often through referrals in different systems, I just sometimes like get a lot. Once I started looking for health insurance online, like I get all these Facebook ads that were like from Covering Wisconsin or from like other, agencies that were like, "Are you looking for health insurance?" Sometimes it's hard to trust those because I'm like, "Is this spam?" But like sometimes it can be helpful just to get those things like on social media, like in my Facebook or Instagram feed or whatever. So yeah.
I am glad you mentioned scams and getting those ads once you're searching online for health insurance. This is an issue that I think consumers and navigators alike are very concerned about. These scams, they often look legitimate, and we want to find more ways to keep people safe from them. I'm curious for anybody who might have thoughts on this. When you were looking for information, did you come across anything that looked like a scam? And what would your advice be to friends or family to avoid scams for health insurance, if you have any thoughts on that?
I didn't, but again, it's because I have a friend who I knew worked as a navigator, and when we became friends, so we became friends before I needed navigator services, right? And so any insurance questions I have, or how to access insurance, I go straight to her. And so my advice when I have friends who are exiting their job and going full time, or their income has changed as an entrepreneur and so they no longer can afford marketplace and they need like state insurance, because that happens as well, I just reach out to my friend and say, is it okay if I connect someone to you for work? She says yes, and then I just connect them and let them kind of do their thing from there.
I'm glad that you shared all that. Navigators can be such resources in their community and even amongst our own family and friends. When you have a navigator, just sending them a screenshot of something you received that you find suspicious, I know I find myself vetting things like that for people pretty often. Lavonda, were you going to say something?
I was getting ready to say, when Rachel said like those who have, some people have disabilities, and there's some that just, they may not be able to read, or they can't, and that, or some of the seniors, it's just that they can't see it, so when we say social media is great, for the young, sometimes that's a barrier for the older, seniors and those who have disability, such as, reading issues or other, like I said, that can't, vision issues. And seniors really, when some of them, they're not on the computer as much as, we are, and even I still have problems with the computer, but they need, they want to talk to someone, yep, to figure this out. They're not trying to read all of this, because I can tell you right now, some of the seniors that I know, they say the print is too little, on the computer, and they want to actually speak with someone. So I don't know. I mean, I don't know what everything that's out there on how to reach the community, but somehow I was thinking of like maybe to have stations set up, like at some libraries or something, where it's a healthcare where they can go in and actually speak with the navigator, have it, have the number so they can schedule or just go in. But if it's at a public place like the library or a community center, some of the senior, community centers, but it's open to everyone, so they can go in there and get some support on the services, because they need it broken down too. When they see the terminology, they don't understand it. I didn't understand it. So, that would probably help, with, especially, I'm thinking in the Milwaukee community too, that, it's just such a wide range of, individuals that we have to meet. that
Yeah.
need help.
Yeah, I think that's a great point. You know, seeing the two different sides, the spectrum of young adults and then elderly seniors. My mom will not do a Zoom. My mom won't purchase anything. She uses the internet, but she's like, she'll walk out of her doctor's appointment and needs hard copy in her hand so she can put it in her files. It's old school. It's what she's comfortable with. She can't hear very well. Her sight's okay, but I think it's a great point that you bring up, because it's definitely out there. And having a library center, the library is a huge trusted place in the community. That's
Yep.
like one of the only places my mother will go to after the pandemic, so I think that's a great point that you bring up.
And I think for the younger ones too, even at some of the universities, to actually, they have the TVs out in the hall, and maybe to just have like maybe a commercial or something, just to brief.
And they, they say
see it in the lunchroom or in the union area, and if they need it, they'll look it up. They'll
right. Campus healthcare. That's just
the real short brief, because if it's too long, then they're gonna listen.
Yeah, you can get all this mental health, but it's going to be 6 months from now. And then what is it? I think mental health is a huge problem. I mean, it's needed. So I like your ideas.
Yes. Thank you all for sharing the different outreach ideas. I do think at Covering Wisconsin and among enrollment assisters, there's a lot of support and understanding around the idea that different outreach and promotional methods are more effective for different audiences, and we don't want to leave anyone out. So thank you all for sharing those different perspectives. If there aren't any other thoughts on scams or outreach messaging, I can move on to another question. I apologize if there's background noise. There's some yard work being done around here. When you first needed to find health insurance, had you heard about healthcare.gov or the marketplace or Medicaid or Badger Care? Was this new for you, or was it something you'd learned about before? Anybody who has thoughts is welcome to share.
I guess I'd heard about Badger Care. No idea, since I never had to, access it. And so the television commercial I saw was really the bloodline. I didn't know about all these programs because I never had to use them. Mm-hmm. My company always provided me with insurance. Mm-hmm. So, yeah.
Totally makes sense. Any other thoughts?
I'd heard about it through the political landscape. So through like the name that it was called, like Marketplace, Obamacare, whatever, like that's what I thought it was. And so even though, much like Beth, I'd always had jobs where I was insured, I'll say the idea years before, if there was no Marketplace, I think me quitting my job to become a full-time entrepreneur doesn't happen because I'm not insured. You know what I mean? So I always knew that it was something in the background that was then accessible, but it never occurred to me that I could work somewhere, that I could have a job that didn't offer insurance. You know what I mean? Like that was the whole point of getting a full-time job, that it has those benefits. So to get a full-time job with a nonprofit and they're like, oh, we just have a stipend, so we'll include that in your salary and that's how you get insurance. It was like, whoa. So that's how I learned about it, just following politics and knowing that this thing was happening. I never really thought it was something that I would ever need. I thought it was something that creatives would be able to be a part of, or people who were like underinsured, or I had been doing research and, this was an option if like you were paying too much for insurance, that if you were paying so much over your salary or whatever, that you could opt into this too. So that's kind of how it came into my sphere.
Thank you for sharing that. I sometimes encounter people who are familiar with these programs because of political conversations and sometimes political rhetoric. And it sounds like in your case, this was a positive thing because it made you aware of what the resources were that were available. I'm curious. Sometimes I think that being aware of these programs from political conversations can actually act as a barrier if it influences somebody's perceptions of the programs as being a good or a bad thing, maybe more so a bad thing when it acts as a barrier. Does anyone have any thoughts on that or perceptions?
I was a freelance musician since graduating college, and that was in 1984. So this was way before there was anything like marketplace insurance. So I had absolutely no health care up until marketplace occurred, and that was very recently. And yes, of course, I heard all the political rhetoric. For me, it wasn't a barrier because I was waiting to pounce on it as soon as it became available. The only thing I would say is what I had heard was that it was either inadequate or too expensive for someone like me to use. But I was so curious and so desperate that I went to the government website anyway, and I found out that no, that's actually not true. So yes, I heard about all that stuff. Yes, I heard some negative things, but no, I did not find that particularly to be much of a barrier in my case.
Okay.
But again, I don't know I don't know how typical I am because I was, having not had health insurance for that long. I was sort of on the lookout for it. So.
Sure. Great. I have another question that we can go over, and I know there are some questions in the chat, which we'll get to soon. Has anyone here used any of the websites or the digital tools like healthcare.gov for the marketplace or Access for Badger Care Plus or Medicaid? And if you have used them, especially if you tried to using them before you started working with a navigator, how easy were they to use? And do you think you could have used them successfully without a navigator if you did work with a navigator? Looks like John has thoughts. Go for it.
That's using the website at healthcare.gov was my primary way of getting healthcare before I even knew about these navigators. And I found it very easy and simple and, cheesy graphics and the whole thing is very simple. But, and here's the thing, there's all kinds, obviously after working with you, Tina, I realized that there are all kinds of subtleties and complexities that are hidden from the ordinary Joe's view. You guys as navigators know a lot more of what's going on behind the scenes, backstage than we do, given the website, which is just simply what the website is, very boilerplate, just sign here, click there, boom, you've got healthcare. But for people who have specific certain kinds of needs or incongruities or whatever that don't fit the usual boilerplate, that's where it falls down, and that's where we desperately need navigators like you and your colleagues. So that's what I have to say there.
Okay.
I would like to say the same, like what John was saying, because you're comparing the different plans, and then you say, but like you said, but if you need more, you end up having to go to the hospital more, often or something. And then you find out, wait a minute, they only pay 20%, of this hospital stay, but this plan will pay 80%. Or this one, so it's like give and take, which one, and it can get quite confusing because there are so many. You got the bronze, the silver, all these different plans. So trying to figure out which plan is really going to work for you. So you really want to talk to somebody like, so what does this mean? If I get this one, what are they talking about? So I think just talking to someone really makes a big difference in trying to, you got to have somebody you can ask questions. And so that's why it's nice to have a navigator.
Yeah. And Rachel, was I interpreting correctly? It looks like you have some thoughts.
Yeah, I do. I was actually when I was looking through, I have a lot of different healthcare needs because I have several chronic illnesses and I get some of my medications at the hospital through IV. So it's what is that classified? Is that like a procedure? Is that and so it's just hard to find whether or not what kind of coverage would be offered for that. And then the other thing that I was looking for is I'm in the process of getting medical equipment. And so I need insurance to cover durable medical equipment providers. And I remember like putting in several that I knew existed in the area, just like from information from the healthcare system that I use. And I couldn't find that like that those were covered under any of the plans that also covered my primary care provider and my other medications. So that was really challenging for me. I was like, how am I going to get everything that I need covered under one plan? And then when I ended up calling one of the health insurance plans to see if they did cover durable medical equipment providers, they were like, oh, yeah, we do cover that. It just wasn't showing on the marketplace. And so again, it was like sort of that issue of like, I think sometimes they don't update their information on there as frequently as they need to. And so there was just like also just challenges of even getting correct information through there. And I had to actually call the insurance company to see like what they were covering because it wasn't showing on just like the website itself.
Okay. Well, that's all. Yeah, Kanita.
I think, to Miss Lavanda's point, if you can sit down with a navigator is best. So I don't do anything with Marketplace. I set a meeting with the navigator. We take the 30 minutes or an hour that we need to do. We go through the silver, bronze, and gold. Like, cause I don't have time. I just want this done. I'm a firm believer that we have so many decisions we have to make a day. And I am all about decreasing the amount of decisions I have to make because by 2:00, I'm decisioned out. So I have a very small window where I'm really good and adept and able to do the things I need to do. And so I live by my navigator appointments. I'll also mention I've used the Access website too. And it's not great when you have to like upload your documents. So I have a scanner. And so I've tried to like scan all my documents in, and it's too large to upload. So then you got to do it one by one, or you got to use your cell phone and take a photo and then upload it. Well, that requires you to download the app on your phone. And I'm kind of technologically savvy, right? Like I've grown up with MySpace and Facebook my whole life, right? And so I have access to a printer, a cell phone. It's an Android, but it's good. And so I have access to all of these different things. I got a car, so when that doesn't work, I can just pull up with my documents to my nearest location, right? I think from an equity standpoint, I recognize that there's a lot of folks who don't have that access, who don't have a scanner, who don't have a phone that maybe will take the quality photos needed to be able to upload it. Or as Beth mentioned about her mom, they don't engage with the world in that way. You know what I mean? They don't have a car to be able to just hop in their car to just go. And I think that we have to think more about those people because like, I'm okay. If that file doesn't upload, you'll see me in the morning. You might see me within an hour, depending on what I have to do. But there's a lot of other folks who don't have that type of accessibility.
Yeah, excellent points. Thank you so much for sharing all that. And I'll reiterate one of the points you made, which is this is why having a navigator can be so valuable because we can often help when someone needs to upload documents or feels unnerved by these digital systems. And we know what the resources are beyond the digital systems. I have one final brief question before we'll go to questions from others. And it's a perception question, so there really is no right answer. The big topic for navigators right now is this so-called unwinding. When you hear unwinding, I'm curious, are you familiar with that term at all? And have you heard it in relation to health coverage? Does it mean anything to you?
Not to me. I've never heard it.
Okay. I haven't either.
Neither.
Yeah.
Never heard it.
Rachel has her hand up.
I mean, yeah, as someone who is on Medicaid and was on Medicaid through the whole like pandemic, I was something, and I also was working with a benefits counselor too, so she also kept me in the loop. But yeah, it basically during Medicaid, during the pandemic, they had continuous Medicaid enrollment. So basically, people were didn't have to do their Medicaid renewals. So then people had to start doing their Medicaid renewals again. So that's basically the unwinding, is that a lot of people are now becoming ineligible for Medicaid now that they have to do their Medicaid renewals. So that was something I was always very aware of because I had previously been doing my renewals, and then during the pandemic, I didn't have to do them anymore. That was really helpful for me because I am someone who doesn't have a car, um, finds the Access website very difficult to access. Like again, that document issue. I was recently trying to upload my documents. It was like less than 1 MB, and it like converted it into 10 megabytes or something. It was crazy. So just like, um, I'm always someone that has to do it in paper. I would have to like, and as someone with a disability, having to go to my employers and get like them to sign all the forms in order to like send it to Medicaid. It was like very difficult for me. So there were times where I'd go like on and off of Medicaid just because I like couldn't get my documents in on time or didn't get the right documents in on time. So to not have to do that for the duration of the pandemic was really great for me. So yeah, it does mean something to me because it did mean that I had to do my renewal again, and that is why I ended up reaching out to Tina and covering Wisconsin. So
Yes. And in everyday terms, that's exactly what we're talking about is renewals for Medicaid and Badger Care Plus when we talk about the unwinding. This term unwinding is coming from we are returning to the pre-pandemic Medicaid and Badger Care Plus policies, which are completing an annual renewal. And each time you complete that renewal, there's what's called a redetermination to determine whether you're still eligible for Medicaid. And if not, you're unenrolled, and then a navigator can help you find your other options. Since there weren't renewals during those 3 years of the COVID-19 pandemic, many people who became ineligible weren't unenrolled. And so we have maybe a higher rate of people now who are ineligible and need help transitioning to another form of coverage. So it's a big undertaking, and we're the right people to take it on. But it's definitely been a recurring theme of this conference. I wanted to give some time to any questions from others. I see one question right here that asks what loophole I used. I think this is in reference to John's introduction. I want to keep confidential information confidential. It wasn't really a loophole. Anybody who completed a healthcare.gov application would have had this step. But part of the media consent form process here is that anything that was addressed or managed in your navigator appointment is still beholden to those same privacy requirements as in that original consent form. So I don't know that I can answer it directly. Allison, I think you mentioned that there were some other questions from the audience, and I don't know why, but I don't see them in the Q&A.
Yeah, absolutely. Lots of comments, lots of great comments, which is really nice to see also. There's one question, and this is a broader question, maybe just for you, Tina. It's, does Covering Wisconsin have advertisements, flyers for college students? I think this is thinking about some of Rachel's experiences and young adults.
When we create our outreach materials and our promotional materials, we do consider many different audiences, including college students. And we certainly have outreach materials and promotional items that I would say are geared toward college students or are intended sometimes for younger audiences or for colleges where we might have outstationing, where a navigator might have office hours there. Like I have office hours at Madison Area Technical College, and that can be a slightly different demographic than the traditional college student group. So in summary, yes, we do. Sometimes it's not as concise as aiming for an 18 to 22-year-old audience, but we do certainly include college students as a population when we're to consider when we're creating our outreach and promotional materials.
Great. There's another, more just a comment, also thinking, I think this panel has really generated, from what I see, a lot of inspiration and thinking about how can we improve the outreach and the messaging that we're doing. One thought was more materials that have large font. This individual said they just don't see that out there for regarding health coverage, and so making sure that we attend to the needs of that community as well. Let's see. Here's another partial comment and question. I love Kanita's observation that understanding health insurance is an equity issue. Would any other panelists like to address health equity as it relates to having insurance, receiving information, using systems like healthcare.gov and the Access website, and finding help to get and maintain health insurance?
Good question.
Well, I'm
Okay,
happy
look
to hop
at-
back in.
Yeah, go ahead.
Well, I think, because of my work in Milwaukee with the artist community, and again, local artists, musicians, visual artists, and just seeing seeing the disparity, right? Whether it's socioeconomically, whether it's racial, whether it's whatever neighborhood you live in, right? Like those things are real and they show up everywhere. They show up in every imaginable way. And so often underinsured, underserved, uninsured, right? They show up in a lot of other places. Folks who have different accessibility issues, right? That Rachel talked so eloquently about. So I think often we think about these issues in silos, but they intersect and they live together. And so how do we create an equitable world for everybody? I think healthcare, food access. So even, though this call is about insurance, when you think about the food share program, you know what I mean? Like the pandemic was the first time a lot of artists could even get access to that, even though they needed it long before. You know what I mean? In our artist community, they're often the folks serving you drinks at bars. That's what they're doing while they're, practicing their art during the day. And so I am a firm believer that communities thrive when everyone thrives. And we can't all thrive if our basic needs are not met, insurance and food being two of them. And I think now with the marketplace, the healthcare marketplace, that begins to create a little bit of equity, right? So that more folks can get engaged. But if you don't know a navigator, I mean, I met so many artists, and I'm sorry to talk so much, but I know so many artists who just presumed they couldn't afford it. One of the people on my team was paying twice what I was paying and had no underlying health issues, no auto. So when I told him how much I was paying, and he didn't have dental, I had dental, so he's paying twice what I'm paying and wasn't even fully covered. So to John's point earlier, yes, word of mouth helps, but educating folks on navigators and just the importance of being taken care of so that they can continue to contribute to society. I think those are small steps we can take to increase the equity for everybody.
I apologize that this platform kicked me out for a few moments, so I did miss that question. But thank you so much for your answer, Kanita. Thank you, Allison, for facilitating the Q&A in my absence, especially.
Absolutely. Yes. Thank you, Kanita. That was a great response. There's a couple questions wanting to dig in a little bit more about scams. I know that covering Wisconsin especially, and I think this is really happening lots of places. How do we present information so that people don't think it's a scam? And there was already some talk among this group, but I guess any additional thoughts about what kind of messages, what kind of imagery, what kind of phrases, or how can we convey in an ad that, yeah, you can trust us?
I think I could take this one. So I'm someone who has both gets a lot of scams and has fallen for them. So very recently, actually, but that's another story. I think for me, the big thing is scammers these days are just so good. And a lot of times they will do things where they will like duplicate the website and everything so it looks identical to like a valid website. And so I think the most important thing for me is these days, I've just learned I really cannot trust most things unless it's coming through an organization that I already trust. So if like it's being shared through local organizations, then I'll be like, oh, this is something that I can trust. And so I think that is like one of the most important things for me is where I'm getting the information. Because if I'm just getting it through an email or if I'm getting it through an ad, I might feel like I have to be suspicious just based off of the fact that I have gotten scammed in those ways before. So I think it's not so much like what does it look like versus where am I getting the information. And so, yeah, I think that is one of the most important things for me.
Great. There's another question, and this is probably more for Tina. Just asking, can you forward any of the materials you use to agencies to have?
Any of the materials I used.
Maybe, I don't know if it's materials for this session or just if they mean outreach materials in general.
You can find our outreach materials on our website, on our toolkit at coveringwi.org/toolkit. And you can ask me for any of them if you want your contact information and or logo added to it. For other materials and resources, you're welcome to reach out to me directly if there's something that was mentioned that you'd like to know more about or have. So long as it's not something confidential, I am happy to share resources with other agencies. And I do a good amount of partner engagement in my interim role. So I do share materials with others pretty often. Of course, not confidential ones.
Great. And maybe this is the last one that I see so far in the Q&A, but it might be a nice one to round out. So somebody shares that their own lived experience is what drew them to this career path and keeps them passionate about what they do. She has a question. Do you have any advice about how to share your lived experience in a professional way? And so you feel like you're not oversharing, but at the same time being real and transparent, which I think you all have shown us and demonstrated for us today. But I guess any additional thoughts about that? And I don't know, Tina, if you have your own thoughts about that.
Yeah, I wanted to open it to our consumer panelists first, since this is about them. And relatedly, I can answer this question directly.
I just ask people, are they insured? In my network, I'm not going around putting up social media posts like, hey, tell me. But people in my personal network. So there are phrases that I listen for. So for my friends who are entrepreneurs, this month I didn't make as much money as I made last month, right? Or my client load is low. Or, with artists, I know that here in Milwaukee, our work is very seasonal, and that season actually is coming to an end now. Mm-hmm. So by the time Halloween comes, musicians, artists will not be gigging well into February, March. That just is what it is, right? Because we're not doing outdoor events, that type of thing. So when I hear that with creatives, I'm like, are you insured? Are you taken care of? Here's some resources. And then allowing folks to do what they need to do, and use them as they need to. I send links, I connect them with my friend, and we'll share part of my story with them as well.
Rachel, did you have thoughts? Looks like
yeah. So I don't usually do a lot of like lived experience work related to health insurance, but I do a lot of lived experience work related to homelessness. I work on a system level for programs that are related to homeless youth. And so the thing that I've learned about doing lived experience work is, first, lived experience is a form of knowledge, and a lot of times it gets very devalued and discredited. But it is a form of knowledge, and so you should lead into that and not be afraid of sharing your personal experiences. But then the second part of that is that you are not entitled to, no one is entitled to your story. And so it's really important to be sharing what only you feel comfortable sharing. There, a lot of times, especially when you're engaging in lived experience work, people are like, oh, I want to take that story and use it for something, or can you share it with the media? And I think it's really important to know your own boundaries and what you feel comfortable sharing. Because at the end of the day, you're coming to this work wanting to improve systems for other people by sharing your lived experience, but it's not anyone's right to just take your story and use it for how they want to use it. So, yeah.
All I can think of is that I've started really realizing, as far as how like different coverage, health care coverage, like this summer, due to like back to school, events where different agencies were at the event, like a navigator. Actually, my navigator was at a couple of events, but that's when it kind of speared the conversation about your insurance, your coverage you have. And it's like, oh, this table, like what are they doing at this table? Or what are they, you know, what are they doing at this? What does this table offer? So having it, just more out there, and I know when Kanita said, like, especially during the, as far as artists, because most of the events like took place during the summer, they're outdoors. But I think we're going to have to get more, have tables out, like agencies out there, like the navigators out there, a health table or something, where they can have the resources that are available out there to kind of share. And then you can kind of get in conversation, you can guide them to it, or, I'm just trying to, just out there more in it. Like we probably have to get back into some of the churches when they have events, or back into some of the schools events, so that we can have that conversation, when they see it out there, then you can kind of share like what happened to you, your experiences, if you feel comfortable. But if they're there, like at one of the events, that might help, as far as the whole conversation about health, who has health insurance, who needs help. Like I said, with the my friend, with the one who she was paying all that money for her medication, and how it was just that, she was able to find, I could talk, she met a navigator who could help her with it. So I don't, that's all
Yeah.
I just don't know how to.
That's a great answer. Yeah. If I can even briefly respond to this a bit, just as somebody who my lived experience also guided me toward this work, we always say to keep consumers first, and that's what we do. Consumers always come first. So it's not always appropriate for me to share my own lived experience, but you can always use your lived experience as fuel for what you're doing to keep the passion for what you're doing alive. And to Rachel's point about the knowledge you have from that lived experience, you can use it as guiding knowledge in your work. For example, I know I had a lot of experience with misinformation and not quite understanding healthcare.gov and what resources were available through there. And so when I'm talking to somebody who is experiencing something similar, I can understand their perspective a bit and use that to empathize when I'm helping them learn what the different resources are. Allison, was there any one final burning question we wanted to highlight before wrapping up?
I think the way that you all shared, and I think rounding out on this session this question is a great way to close the session. I know that there's more comments and some questions that we didn't get to, but we do take these questions back, and we will try to post any responses on our website where we post the session recordings, as well as the PowerPoint, any PowerPoints used. I just want to thank you, Tina, and this panel so much for your time, your thoughts, your perspectives. I think so inspiring and motivating. If I could speak for all the attendees, I'm going to say this was very motivating and just so important for us to hear and be reminded of just what are the actual experiences that you all have. so that we can do our jobs better. So thank you. I really appreciate that. And with that, we're going to close our conference. So thank you all again for attending. Please fill out the evaluation. We will be emailing that to you as well. And thank you for your engagement. And we look forward to seeing you all in the field.